there is one important factor that plays a very big role in the health of the mother and the baby during pregnancy. But this is not discussed much. Want to know what it is? It is the level of sleep that a mother has during pregnancy. If you want to know more about it, watch the full video. Hi, this is Saranya and I am the founder of Babypedia and a birth professional. I have helped more than 2,500 couples navigate pregnancy, birth and taking care of their baby with a lot of confidence and ease. Let's talk about the importance of good sleep during pregnancy. Studies tell us that pregnant women must have a minimum of 6 hours of quality sleep every day during pregnancy. Yes, I know it can be difficult with all the discomforts like frequent urination, backache, leg cramps, heartburn, vomiting, and much more that happens during pregnancy, right? But you will have to prioritize your sleep. Let me tell you why, because it has a lot of benefits. When mothers sleep less than 6 hours, studies tell us that there is a higher chance of you getting pregnancy complications like gestational diabetes, preeclampsia, blood pressure, etc. There's also a higher chance of you experiencing a longer and more painful labor and delivery, and a higher chance of you having a cesarean birth. There are effects on your baby as well. Your baby may be born with a low birth weight and may be very fussy and cranky after birth, leading to more crying in the first few weeks after birth. So why does this happen? We have to understand one very important factor. The growth hormone is produced in the human body when we sleep deeply. So now when the mother is not sleeping well, the growth hormone that is secreted is very less or sometimes is not secreted. So this will affect the weight gain and the development of your baby. So now please note that I keep telling 6 hours in a day because sometimes you may not be able to sleep for 6 hours properly in the night. So then try to compensate it in the daytime. Okay, so maybe have a 20-minute power nap in the morning, in the mid-morning or in the afternoon, sleep early and all that. Okay, now let me give you some tips on how to improve your sleep quality and duration during pregnancy. Tip number 1, try to sleep around the same time every day. So let's say 9 o'clock is your bedtime. Try to at least sleep between 8:30 to 9:30. Okay, what this happens is slowly when you start sleeping around the same time every week, every day for a week or two, your body and your brain starts getting used to the fact that you sleep at that time. So your body will start secreting the sleep hormone melatonin 1 hour before you go to bed. So now your body is prepped and primed to go to bed. Once you hit the bed at around 9:30, you will fall asleep fast and you will be able to sleep much more deeply. The second tip is sleep in a pitch dark room. Make the room as dark as you possibly can because the darker the room is, the more sleep hormone melatonin will be secreted. Hence, you will be able to sleep much better. The third tip, keep the room at a comfortable temperature. It should not be too cold. It should not be too hot. Have a blanket near you in case or a bedsheet near you in case you feel cold in the middle so that your sleep does not get disrupted because of the temperature changes. Right? The next tip is take a warm bath before you go to bed. If you have a shower, yes, stand under the water, warm or a little hot water. If you have a tub, take a soak. That's well and good. Because warm water will relax all your muscles. When your muscles are relaxed, the chances of getting leg cramps, backache, etc. and all these discomforts will reduce drastically. Another thing you can do is do stretches before you go to bed. So let's say you get a lot of leg cramps during sleep. Start doing leg stretches, ankle rotations, ankle stretches to loosen up all the muscles so that they don't cramp up in the night. Similarly, if you experience backache, you can do some back stretches, simple back stretches before you go to bed. Next, listen to some nice soothing music. There are a lot of tracks available on YouTube and online that will help facilitate deep sleep. Okay, so you can listen to such tracks so that you relax well and you can sleep well. Another thing you can do is before you go to bed, try deep breathing. Just a simple inhale through your nose, exhale through your mouth for 21 counts before you go to bed. You could also do visualization. You could connect with your baby and you can start talking with your baby. Anything that makes you feel very relaxed and experience a lot of good hormones. This will help you to sleep much better. Okay, you could also try a little bit of meditation if you like meditation and you would love to do it as well. Another thing that you can do is prep the atmosphere 1 hour before. Try not to use any screens. It could be your mobile, it could be the TV, it could be a laptop, it could be the iPad. Try not to have a bright light in front of your face. Though most of the devices nowadays come with the eye protection lights, there are glasses for the blue light. Just the fact that there is a light that's that's brightly shining on your face can lead to reduction in the secretion of melatonin. So wrap everything up 1 hour before and follow this routine where you nicely massage some oil. Ask your partner to massage you before you go to bed, because that will also help you have a good night's sleep. So maybe a little bit of massage from your partner, then go take a warm bath, come out, apply nice moisturizer so that you don't get stretch marks, your skin is hydrated, you're massaging your tummy and connecting with your baby. You could do some stretches, then sit down, do some deep breathing, or you can lie down and do some deep breathing. Listen to some tracks that help you relax, like the passive relaxation script. I will link one in the description below so that you can listen to it before you go to bed. Connect with your baby, listen to some nice soothing music, and by the time all this is done, it'll be 1 hour and you'll be drifting off to bed. Okay, this is like a beautiful sleep routine that will ensure that you're getting good sleep, deep sleep, and you're able to sleep for longer. One important tip: try to reduce the amount of liquids you are taking in 3 hours before you go to bed. This will help reduce frequent urination also. If you found this video useful, don't forget to like, subscribe so that you get updates on further videos on pregnancy, birth, and taking care of your baby. Till then, take care. This is Saranya signing off.